Thank you very much for taking my question. This is on the Lambda variant. There's a lot of concern being raised in various quarters after the Japanese study that showed that it has mutations that might resist neutralization by vaccine-induced antibodies. What is WHO's level of concern, and should this not be listed as a variant of concern by now? Thank you.
So thanks very much for the question on the Lambda variant. The Lambda variant is one of several variants of interest that WHO is tracking around the world at the global level. As you know, we have 4 variants of concern. We have at least 4 variants of interest. We have 13 alerts that we're following, and we have many, many more signals that we're looking at. And what we're doing is the Lambda variant does have, it's known as C37. It is classified as a variant of interest. I was just checking our GISAID database, the online database, and looking at where this is circulating. It's been reported in more than 40 countries right now, but most of those reports of sequences that have been shared on GISAID report less than 10 sequences. And so it is actively being discussed as a variant of interest because it is being reported in a number of countries. But what we're looking at is how well it circulates, how much transmission takes off once the variant is detected. And in fact, it really doesn't seem to take off once it is reported in a country. Even in Peru, where it was first detected, reports from our PAHO colleagues actually state that the Gamma variant, the P1 variant, is outcompeting the Lambda variant. You mentioned some mutations of interest. We're also looking at those. There are several mutations in the Lambda variant in the spike protein. There are some amino acid deletions. There's a number of characteristics of it that cause some concern because, of course, any changes in the virus pose some threat to its ability for the vaccines to work.
We will go to the last question for today, and that's Agence France Presse. Robin Millar is with us. Robin.
Thank you. With the numbers of recorded new cases still increasing and set to go past 200 million very soon, how concerned are you about the numbers of people that may be suffering from long COVID? And is this something that member states should be placing more attention on? Thank you.
Thanks very much for this really important question. The answer is absolutely. This post-COVID syndrome or long COVID is something that WHO is deeply concerned about. We have been working with patient groups, with clinicians, some clinicians who are patients suffering from long COVID, on looking at making sure that we have recognition of this because this is real. Individuals who pass the acute phase of infection, the acute disease and recover from that, many are suffering from long-term effects. We don't know for how long these effects last, and in fact, we're even working on a case definition to better understand and describe what this post-COVID syndrome is. It can last 3 months, it can last 6 months. The head of our clinical management team, Dr. Janet Diaz, and colleagues around the organization are looking at brain health, mental health, looking at different organs in terms of how this virus is affecting people in the long term. And we are working to make sure that we have recognition of this, that we have better rehab for individuals who have been infected with the SARS-CoV-2 virus, who have suffered from COVID-19, who have survived it, but are dealing with longer-term effects, and that we have good research so that we really understand what post-COVID syndrome is and how it can be better managed. We advise anyone who is suffering from the long-term effects following infection to seek help. And to make sure that the help that they seek is of a multidisciplinary nature because it affects so many different organs of the body. And we do ask that member states take this seriously, and member states are. But we want to ensure that the research that is taking place is not just happening in high-income countries, that it is happening in countries all over the world, so that we really study this properly and that we have good recognition, rehab, and research.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.